We appreciate you joining us today for our virtual Lunch and Learn as we discuss mental health matters. Stress and anxiety can have a profound effect on our mental health, but there are steps you can take to better manage those issues and prioritize your own mental well being. May is Mental Health Awareness Month. In honor of that, we've assembled a panel of experts to discuss your mental health matters. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by nurse practitioners Rochelle Sharp and Olivia Patterson, as well as licensed clinical social worker Bridget Ormond. If you don't mind, I'll have the three of you just take a minute to introduce yourselves. Rochelle, if you want to start.
Okay, my name is Rochelle Sharp. I am an advanced practice nurse and I work in behavioral health here at Blessing Physician Services. I have been in nursing for 32 years. I am dual certified as a family nurse practitioner and psychiatric mental health nurse practitioner. Received my bachelor's degree at Blessing Riemann, my family nurse practitioner at Chamberlain, and then my psychiatric at University of St. Francis. I've been in this role for 5 years and I work full-time as a nurse practitioner.
All right, and Bridget, if you'd like to introduce yourself.
Hi, I'm Bridget Ormond. I'm a licensed clinical social worker, and I've been with Blessing for 12 and a half years now. I work with patients in integrated care with primary care and the specialists here at Blessing Hospital, Blessing Physician Services. I help supervise a group of behavioral health therapists that are integrated into these areas, and I am also seeing our employees for our EAP program.
All right, and Olivia?
Hi, my name is Olivia Patterson, and I have been a nurse for 4 years. I was in the emergency department for most of that time, and I recently graduated with my psychiatric mental health nurse practitioner degree from Vanderbilt. And I'm now in a role, multiple roles actually, where I'm seeing patients in the outpatient setting, as well as doing consults in the emergency department. And I'm going to be talking to you a little bit about the Best Self Center today, which is our new program that I'm also the provider for.
Well, great. Thank you all three for joining us. And again, thank you for your patience as we kind of worked through some technical issues. But we're so happy to talk to you guys all today about mental health and in honor of Mental Health Awareness Month. I want to kind of start out with self-care. We all hear about it, and it is proven to reduce stress and anxiety. But studies show on average, people only spend about 15 minutes a day on health-related self-care. So, Bridget, what are some ways that we can better prioritize our own self-care?
Sure. So I think focusing on some of those areas in your life where you can work self-care into your day, thinking about the things that are important to you and not losing sight of those, spending time with friends and family, paying attention to how you talk to yourself in your head and kind of that dialogue that you use, and setting boundaries, learning to say no. In today's world, we have a lot of multitasking going on, and there's a lot of requests, and so knowing when we need to say no. We will talk about exercise and sleep and some of those things in today's discussion, but those are very important for self-care and prioritizing to make sure you get enough sleep and that you are trying to make some healthy choices to eat foods that help you feel good.
Well, perfect. Thank you so much for kind of briefly talking about that. As you mentioned, self-care is a huge topic. Now, one of the things that we hear a lot, and I know I'm guilty of it too, is we talk about, I feel so drained, and maybe it's stress, maybe it's anxiety, maybe it's just a really busy schedule. But a common symptom of depression is feeling tired or having very little energy. So, Rochelle, how can we tell if we're just tired or maybe it is something more like depression? Is it a warning sign, or do we just need to maybe slow down a little bit?
It could potentially be a warning sign. Along with that, you need to have mood changes that would last at least 2 weeks for a major depressive episode. And that's feelings of hopelessness, helplessness, worthlessness, low energy, maybe guilt that you're not taking care of your children or your family as much as you would like, loss of interest in normal pleasurable activities, such as if you like crafting or gardening, etc. Changes in sleep, changes in appetite, just overall just don't feel good and can't really put your finger on it, as well as maybe that mood has been that low for at least 2 weeks. Could be by triggers even. If someone has a lot of stressors and they're predisposed, maybe family history of depression or anxiety, they could have some triggers that would also trigger that, and recognizing those changes for what they are, and just one little stressor could cause you to have an acute episode.
Okay, so maybe just more than feeling tired, watching out for some of those other symptoms as you kind of discussed. Now, we hinted to this earlier, but I know some of our personal habits and our physical health can impact our mental health. Rochelle, can you discuss how things like diet, exercise, sleep can affect your overall mental health?
When you exercise and you do things that you really enjoy, such as like fun activities such as roller skating or gardening or anything along those lines that people tend to enjoy, it raises your serotonin levels, which is almost a natural high or a natural mood booster. So by having like good nutrition, increased exercise, increased self-care, adequate sleep, things like that can actually improve your mood just by raising those serotonin levels naturally.
Okay. So doing the things that we enjoy are actually, it's not only good for our physical health, taking care of our physical health can actually help benefit our mental health. So that's really important to remember. Now, you guys also touched on this when we were in our introductions, but Blessing offers a wide range of services, both inpatient and outpatient, to address a variety of mental health concerns. Now, one of the newest options is a partial hospitalization program known as the Blessing Empowerment Self-Transformation Center, or the Best Self Center. Olivia, can you please introduce this new service? Tell us what it's all about.
Yeah, absolutely. So this is a new level of care that we didn't previously have in our community. I think of it as in between inpatient and outpatient. So it's for those patients that they need more than what we can provide in the outpatient service. So maybe they're needing more frequent therapy or more frequent medication changes. This program is running Monday through Friday. It's primarily group therapy and as well as individual therapy, and then medication management throughout the day. It's actually been going really well. It's new and we're starting to fill up quickly, so it's really taking off.
Now, what is the process if someone feels like they might benefit from the services offered at the Best Self Center? Is there a referral? How can they get more information?
So there's a couple different ways. If you're an individual and you're not already set up with somebody outpatient, or like that could be even at Transitions or Clarity, other services in the area. If you're just an individual and you're wanting to, we have a number, which I can say right now, 217-223-8400, extension 4620. That number will get you to a caseworker, and there will be some questions, and then you'll get scheduled with an appointment, an initial intake to see if you meet criteria for the program and if it's a good fit. If you are established with somebody already outpatient, you can have that provider put in that referral for you. Therapists, nurse practitioners, doctors, all over the spectrum can put that order in to get a referral placed.
Okay, well, thank you so much for sharing that information. And we will make sure to that phone number for referrals is available on our website. So at the end of our discussion, we'll get you that information so that you can, if you're interested in getting more information on the Best Self Center, you can find that easily. Now, there is unfortunately still somewhat of a stigma that exists when it comes to mental health therapy and treatment. Rochelle, what would you say to someone who is maybe hesitant to seek help or treatment if they feel like they're having maybe some mental health issues?
What I tell my patients is that just like having heart disease, your heart is not working as well as it should. Same with diabetes. Your pancreas is not working as it should. It puts out too much of one thing or not enough of another. It's the same with your brain. When you have trauma or you have triggers, you have things that have happened in your life experiences, it tends to cause your brain to do the same thing and misfire in certain areas. So you might have too much serotonin or not enough, too much norepinephrine, not enough, etc. All these medications do is they help regulate and even out those neurotransmitters. So it's just like having diabetes or hypertension or anything else. It's a physical problem that you see it manifesting in a behavioral aspect. So really, for someone who comes in and says, I think I have depression or I think I have anxiety, there's neurochemical changes in your brain is what causes it. So there's really nothing to be ashamed of.
So it's something that people should definitely seek help for, because it might not necessarily be something that they can control. There might be an underlying issue that's maybe causing the mental health symptoms that they're experiencing.
Absolutely. For some people, the same with schizophrenia or bipolar disorder, there are certain ages that people tend to be higher risk. So, and a lot of times we have to say, are you hearing voices or seeing things that are not there? Because maybe they've seen it for years, but they never knew to say anything or never knew to get help for that. They just thought that was the way they were wired. And once things clear up and they get in a more stable place in their life, they seem to be really thriving and doing much better, having a much happier and better quality of life.
Well, that's really good to know. And again, it all is about improving your overall health and your well-being, and addressing those things that are maybe keeping you from having, an overall healthy way of living. So, beyond Blessing's commitment to providing mental health services to our community, Blessing also offers a unique program to prioritize the mental health of our employees. Bridget, can you talk a little bit about the Employee Assistance Program?
Sure. Our EAP program is available to our employees and their family members. It is a confidential service, and it's designed to assist with any personal problems that they may be struggling with. These services are provided by a master's level prepared therapist, and the employees and family members can call our extension at 4560 here at Blessing and inquire about the intake process. We are able to talk to that patient, to that employee and their family member, to match them up with a therapist who is able to assist them with what they may be seeking.
And now, is that open to any employee? Are there any qualifications they have to meet? How does that work?
Sure. So we have opened up EAP for the rest of this year for unlimited sessions for our employees. We wanted to be there for our employees in response to the stress that we've been under this last year. And for their family members, they are able to have 5 sessions of EAP. And so anybody in our health system that's affiliated with our health system is able to call and seek services.
So a follow-up question again, what about services for adolescents? If, you have a son or a daughter who maybe I feel like needs services, do you offer those to children as well?
We do have therapists that are trained to see children and adults.
Okay, great. Now, I want to thank you all for being here today. Obviously, there are a lot of topics that we can talk about, but I wanted to give you guys an opportunity to maybe add to the conversation. Is there anything that we didn't discuss today that you would really like to stress about the services that are available, about how people can prioritize their own mental well-being? Just anything on this topic that you guys would really like to stress to people who are watching?
I feel like the most important part is advocating for yourself and setting boundaries. For a lot of people, especially whether it be single parents, fathers, mothers, it doesn't matter, grandmothers. We have a lot of grandmothers who are parenting grandchildren now. A lot of opioid abuse and misuse, and a lot of chronic pain. COVID has put a strain and a stress on most people. So I think the hardest part is recognizing the problem and then also advocating for yourself and setting those boundaries, recognizing you can't be everything to everybody. And sometimes just saying no, that I cannot do this or that because I have to do something for myself. You shouldn't have to feel guilty for making yourself a priority.
I think there's that saying, you can't pour from an empty cup. So maybe trying to keep that in mind when you're asked to give more than maybe what you have to give. Is maybe a good way to remember to prioritize yourself. Olivia or Bridget, is there anything that you would like to add today?
I just would like to add to talk to your support system, reach out to your support system. Your primary care provider is a really good resource. They have those behavioral health providers in their offices that they can come talk to you during a visit, and just go seek services. Don't hesitate. I always kind of tell my patients, like, going to therapy is like getting a massage. It's part of taking care of yourself, like getting a pedicure. It feels good to kind of process things and instead of holding it all in.
That's a great way to put it. Olivia, is there anything else you'd like to add?
No, I think these two have got it covered. I second everything they said.
Great. Well, thank you so much. And again, we appreciate your time today and your patience as we dealt with a few technical issues. But again, we're so happy to have talked with you guys today about mental health matters, and all the services that are available through Blessing Health System. Again, thank you for joining us. And for more information and that phone number for more information or referrals on our Best Self Center, you can go to blessinghealth.org/behavioral health. Thank you all so much for joining us today.